Hello, this is Dr. Vijay Raghavan. Welcome to another session. Today's topic is hypertension. This is the second common quiet killer disease. Elevate your awareness, not your pressure. Fight your hypertension with knowledge and action. Now, how common is this disease? 33% or 1 in 3 adults worldwide have high blood pressure according to 2024 statistics. Two-thirds of these high BP people are living in low and middle income countries. Westerners are obese and have high tendency for diabetes mellitus, whereas hypertension, the high BP people are living in low and middle income countries. Nearly half of those with high blood pressure are not aware of the disease. That is why it's a silent disease. This is a major cause for premature death throughout the world. A high blood pressure, otherwise called hypertension in medical parlor, is a persistent recorded blood pressure of at least 3 different occasions, a reading above 140 by 90. As we said, hypertension typically has no signs or symptoms. Age of the individual does not matter, and steps should be taken to keep the pressure in the healthy range. Lifestyle modification may help in reducing high blood pressure. What exactly is this blood pressure? Blood pressure is a pressure exerted on the blood vessel wall by blood that is pumped up by the heart. Now it is logical to decipher that when the heart contracts and pumps up the blood, the pressure is going to be high, and that is what is denoted in the recording as an upper component. That is what medical people call systolic pressure, otherwise pressure exerted by contracting heart. When the heart relaxes and does not pump up the blood for few fractions of the second, the pressure should drop. But due to the elastic recoil of the vessel wall, the pressure does not drop to zero. The pressure recorded when the heart is not pumping is denoted down in your BP recording. That is what we call diastolic pressure, that is when the heart is relaxing. So the BP is recorded as XXX by YY, millimeters of mercury. Millimeters of mercury is a unit for pressure as recorded by raising the mercury column when the recording is done. Let's take a break to enjoy the beauty of our body. Heart is pumping the blood intermittently as it is relaxing after each beat to get its own blood supply and, more importantly, gather blood to pump again. Our organs will be perfused or supplied with energy and oxygen intermittently in a pulsatile manner. But the system is that it does not happen. The body cells get a continuous flow of its nutrients and oxygen. This is possible by the capacity of the arteries. What are the arteries? These are the blood vessels carrying blood from the heart to various organs. So the capacity of the arteries to shrink in size, reducing the volume so that the flow is maintained even during a short microseconds when the heart is not pumping. This elastic recoil is one which causes the diastolic pressure, and obviously it will be lower than during the active pumping. I suppose now you have understood the reason for BP is recorded as 2 numbers stacked on each other. So what is important in this? Most important pressure is mean arterial pressure. Let's understand this. Actually, the body is continuously perfused with this pressure. It is not the average between the high and the low recorded pressure. It is the diastolic pressure, that is lower pressure, plus 1/3 of the difference between the systolic or high and diastolic or lower component of the pressure. So it is diastolic pressure plus 1/3 of the difference between the systolic and diastolic pressure. So if the BP recorded is 120 by 80 millimeters of mercury, that is systolic is 120, diastolic is 80. So mean arterial pressure is 80 plus 120 minus 80, that is 40 by 3, that is 1/3 of 40. So that works out to around 93 millimeters. So your body is continuously getting supplied at the pressure of 93 millimeters of mercury with high and low of 120 and 80 millimeters of mercury. Why is it important to have mean arterial pressure? If the mean arterial pressure drops below 60, the vital organs will not get sufficient food or oxygen. A drop below the critical value for prolonged time will only lead to damage to essential organs like brain, heart, kidney and liver. This dangerous low pressure state is called, in medical terms, shock. Patient is in shock means his blood pressure is very low and his body is not being perfused enough. If the patient is in low pressure for long time for whatever the reason, like poor heart pumping or low blood volume due to severe bleeding, death may occur. Persistent, prolonged, low pressure leads to death, unless immediate measures are taken to get the blood pressure back. That is an emergency situation. Let's get some basic physics. The pressure depends on the volume of blood pumped and the resistance offered by the blood vessel. The resistance is due to the narrowing of the blood vessel due to either their elastic recoiling or thickening due to aging process. The second component for resistance is viscosity of the blood. So pumped up volume depends on the capacity of the heart to pump and the amount of blood in the whole system. So there is more physics, and I think I will stop here impressing you. Back to high blood pressure. Normal blood pressure is 90 by 60 to 120 by 80 millimeters of mercury. In elderly, due to the thickened vessel, 150 by 90 may be considered normal. When it is consistently high, then it is called hypertension. Simply, hyper is high, tension is pressure. So it is simple term, high pressure, it is medically called hypertension. Blood pressure varies during the day depending on your activities. Hence a single reading of high value has no meaning. Please remember this. One single reading of a high blood pressure should not be taken seriously. We'll come to that in a few seconds. Essential point. Do not get panicked because one reading shows a high blood pressure. 3 high readings of blood pressure on different occasions, preferably in calm mental situation, should raise a doubt if the persistent high pressure is there in that patient. What are the stages of hypertension? Stage 1, when the BP is between 140 by 90 to 160 by 100. Whereas it is stage 2, when it is 160 by 100 to 180 by 120. We are talking about a blood pressure of 180 by 120 on 3 different occasions. Then you got to think that it is a persistent hypertension. When it is over 180 by 120, it is called stage 3. This is an emergency situation. When the blood pressure is severe, that is more than 180 by 120, it needs immediate medical attention. So who is at risk of high blood pressure? Elders. Higher the age, higher the chance of increasing blood pressure. This is due to loss of pliability and thickening of the arteries, that are the blood vessels. It is called atherosclerosis in medical terms, which is thickening of the arteries, and it is common with advanced age. Other possible cause for blood pressure is inheritance. Having close relatives with high blood pressure. Unhealthy dietary habit like consuming high salt diet can lead to hypertension. Overweight or obesity is another risk factor for high blood pressure. Smoking. This leads to stiffening and thickening of the arteries at the early age, leading to high BP. alcohol consumption, feeling stressed over a long period of time, and more importantly, lack of physical exercise. What are the do's and don'ts for hypertensives? Do have a healthy, balanced diet. Do exercise regularly. Do lose weight if you are overweight or obese. What are the don'ts? Don't eat too much of salt or salty diet. Don't drink alcohol. Do not drink too much of caffeine like in coffee, tea or cola. And do not smoke. Before we go further, let's get to know what are the types of high blood pressure. When there is no detectable cause for the high blood pressure, it is called essential hypertension. This is the medical term we use, essential hypertension. This is what we are dealing with in this session. This is the commonest cause for high blood pressure. Your BP is high with no known cause for it. It is called essential hypertension. What is essential about it? I don't know. It should have been called primary hypertension as there is no other reason. So when you talk about primary hypertension, there should be a secondary hypertension. When you say essential hypertension, there should be non-essential hypertension. We will not go into it, but few facts about secondary hypertension. Correcting the cause of the high blood pressure will bring down the blood pressure to normal, and the person does not need lifelong medications. Common causes for high blood pressure is kidney disease, diabetes, obesity with sleep apnea, obese people who are having obstructive airway disease leading to stoppage of breathing for few minutes during deep sleep. Some of the medications like oral contraceptive pills or steroids can raise the blood pressure. So if you stop all this, a BP will come down. Before we go further, let's dwell a little bit on pregnancy-induced high blood pressure. Normally during pregnancy, there is a decrease in the blood pressure. This is due to a diffuse dilatation of all the blood vessels throughout the body because the body metabolism increases. Apart from the increased demand by growing fetus or the baby, mother metabolic activity also is very high. To meet the demand of the body, there is a huge dilatation of all the blood vessels. So that causes an increase in the capacity of the vascular system while the blood volume remains the same. So there is a drop in blood pressure. Apart from that, there are multiple changes in the body like increasing size of the uterus. Normal uterus, which is about 5 centimeters in size, grows up to 40 to 45 centimeters in size, and it becomes hugely thickened to support the developing fetus. This increase in size also is met with newer blood vessel formation, and so there is increasing vascular capacity in the body leading to drop in blood pressure. But nearly 10% of pregnant women can develop high blood pressure during pregnancy with adverse effects on their babies. With the restriction of type of medication that can be taken during pregnancy, treatment of high blood pressure during pregnancy is a tricky situation as it deals with the mother and the growing baby. But keeping the blood pressure under control is very, very essential during pregnancy. So coming back to your essential hypertension. What are the clues that you may have hypertension? When to suspect that you may be suffering from high blood pressure? High blood pressure does not produce any symptoms at all. Very occasionally, it can cause headache. This is classically early morning headache. It can produce blurred vision, nose bleeds, chest pain for a short duration and coming repeatedly. These are very non-specific symptoms. Ideal way is to check the blood pressure routinely, especially after the age of 40 years. More so if there are risk factors which we have already seen. Now, why are we talking about this blood pressure all the time? If the BP is not treated or controlled for a long time, it leads to number 1 heart failure, 2 heart attack, 3 strokes, 4 kidney failure, 5 vascular issues, 6 vision issues, and dementia. Typical old age issue with memory loss. It happens in earlier age group in patients with high blood pressure. Let's briefly go through the effect on various organs, starting with the heart. We said heart failure. It is but logical to think that the worst affected organ in high blood pressure is heart. After all, this is the organ that has to pump against the high pressure than usual. So the heart, especially the left half of the heart, which pumps the blood to the whole body, gets its wall thickened to enable the pump against the resistance. Like all other muscles in the body, which becomes bigger when a lot of workup is done. Remember the 3 packs and 4 packs. So when you put the muscle into lot of work, it gets bigger. So heart gets thick-walled. As expected, working against high blood pressure, the heart starts failing to pump effectively, leading to heart failure. Second one is heart attack. So it is easy to decipher that the workload for the heart is more and it has become thick-walled and its oxygen demand increases. Due to the prolonged high blood pressure, the coronary arteries, the blood vessels which supply the blood to the heart, also narrows down. This leads to ischemic heart disease, or often called coronary heart disease. Sudden decrease in the blood supply due to blockage of these vessels lead to heart attack. Heart attacks are common in people with prolonged hypertension when compared to the same age group with normal blood pressure. Third is stroke. The similar issues causing reduced blood supply to some areas of the brain leads to that part of the brain irreversibly damaged, and that is what we call it stroke. When that part of the brain supplying the muscles of the limb gets affected, the person experiences inability to move the limb, that is paralysis. Classically, one half of the body becomes paralyzed. When the visual part of the brain gets involved, there is a loss of vision. Fourth component is kidney failure. Prolonged uncontrolled blood pressure. Repeatedly I have been saying prolonged uncontrolled blood pressure. That is important component. So prolonged uncontrolled blood pressure can narrow down the blood vessel to the kidney, leading to damage to the kidney. This leads to defective filtering capacity of the kidney. So the person's urine output drops. This leads to accumulation of fluid in the body, leading to bloating up of the face and the whole body. The waste products, which are normally passed off in the urine, gets accumulated in the body. Important components are urea, creatinine, and potassium. Coming to the vascular issue, as you can imagine, all the arteries are narrowed down. This leads to defective circulation throughout the body. Deficiency of blood circulation to the lower limb leads to pain in the calf muscle when the person walks. This pain is severe and precipitated by walking when the muscle needs more blood flow. It gets relieved by just stopping the walk and standing for few minutes. Then walk can be continued. This is classically called claudication pain. The pain that appears in your calf muscles when you walk for some distance, relieved by just stopping for few minutes, and you can continue the walk without pain for same distance like before. Combination of smoking, diabetes and high blood pressure is a deadly combination for this peripheral vascular disease or vascular disease affecting the lower limb. Sixth component is eye problems. Hypertensive retinopathy. The vessels in the retina are narrowed. Severe bleeding in the retina is possible. Optic disc swelling may happen. Second possibility is blocking of the blood vessel to the optic nerve or vision nerve can lead to vision loss. Third is sudden painless vision loss due to retinal vein occlusion. Blind spots can appear. Flashes of light can happen. So the list can go on. The eye gets affected by hypertension in various ways. Seventh component is dementia and Alzheimer's disease. Long-term high blood pressure leads to reduced blood flow to the brain. There is a slow deterioration of brain functions. Basic functions like movement and sensations are slowed down. Similarly, higher functions of the brain also start slowly deteriorating. Controlling the blood pressure in the middle life leads to reduced risk of dementia. Before we go, a word about dementia. What is it? It's a progressive, irreversible, and incurable decline in memory, thinking, and ability to gain knowledge and comprehension like thinking, knowing, remembering, judging, and even problem solving. Okay, we saw all this. What can we do about this? Apart from medication, lifestyle modification helps to reduce the blood pressure. Most important thing is weight gain. Weight management, managing the healthy weight. This leads to normalcy in blood pressure without medication. Physical activity is the second important point, leading to improved heart and lung fitness as well as body habitus. Exercise reduces high blood pressure. 150 to 300 minutes per week of moderate intensity exercise or 75 to 150 minutes of vigorous exercise is useful in controlling blood pressure. Minimize sedentary behavior. Don't sit in your table all the time. Third component is diet. At least 5 portions of fruits and vegetables should be consumed as they contain potassium, which reduces the blood pressure. But worry about potassium is only in people with kidney disease. Consume more lean protein and fish. Reduce the salt intake. Low salt diet. Anything more than 1 teaspoon of salt, that is 5 grams per day, increases the blood pressure. Reduced intake can contribute to reduction in high blood pressure. Most of the processed foods contain excessive salt. Vegetarian diet contains high glutamic acid, which has a blood pressure lowering effect. Plant-based proteins help in BP control. Fourth one is alcohol consumption. Alcohol consumption reduction reduces the blood pressure. Non-alcoholic drinks like tea and coffee have beneficial effect on blood pressure and heart health. Grapes, beetroot and pomegranate juice and hibiscus tea helps in BP reduction. Intermittent fasting is no superior to calorie restricted diet in weight and BP reduction. Now this has come into vogue now. People are talking about intermittent fasting. As far as the BP and weight reduction is concerned, it does not make a big difference between intermittent fasting and calorie restricted diet. Sixth one is stress reduction. Mindfulness as a psychosocial stress increases the blood pressure. Coming to sleep. Sleep duration is important. Poor sleep leads to behavioral deviation, results in blunted BP regulation. Disordered sleep like obstructive sleep apnea, where the person stops breathing for some minutes during sleep, is known to cause high blood pressure. Smoking is not directly related to high blood pressure but increases the risk if added. Complications of high blood pressure is increased if smoking is added. Pollution exposure is another important factor in high blood pressure. Thank you for your attention. We'll meet again another day with another topic. This is Dr. Vijay Raghavan signing off. Bye.